Ladies and gentlemen, what we're going to do now is we're going to show you how chemical testing is done for a particular disease. So let's say you are a doctor and you believe that your patient has a particular disease. Let's say you believe they have salmonella and they have suffering from salmonella, and you want to test to see if they have that salmonella disease, the salmonella bacteria living in them. So what you're going to do is you're going to order a chemical test. You can take a sample from your patient. Maybe that sample could be mucus or blood or skin sample, depending on what your urine sample. Depending on what you're actually testing for, you're going to take a different sample to look for that. And then you're going to send that sample away to a laboratory, and that laboratory is going to do a comparison test. And what that happens is the laboratory, we're going to have lots of stored samples that they can compare to. All right, so let's say you're testing for salmonella. So the laboratory will actually get a sample of salmonella, and they're going to compare it to it. So it'll be a control. So this is your positive control. So this is going to symbolize an actual sample of salmonella. And we're going to pour that sample, 3 or 4 drops, into the positive cup. So 4 drops there. All right. So that is a sample of someone who is positive for salmonella. And then you're going to go and you're going to get a sample that does not contain the disease you're looking for. So a negative control, someone who does not have salmonella. All right. You're going to pour that 3 or 4 or 5 drops into the negative. So just as a review, in this first cup, that's salmonella in there. And this second cup, that is not salmonella, or whatever disease that you are particularly want to test for. And then what you're going to do is you're going to get this chemical indicator. And different chemical indicators react with different types of diseases, different types of substances. This indicator is going to turn different colors when it comes in contact with different bacteria, different viruses. So when I pour this indicator into the salmonella, the chemical and the indicator will turn a bluish color, showing that yes, that particular chemical composition that makes up the salmonella is present. And then when you pour it into the person who does not have salmonella, the sample does not have salmonella, that's going to stay pink. So now you can see a clear difference between the sample with salmonella and the sample without salmonella. Right? So that's what it looks like to have salmonella, and that's what it looks like to not have salmonella, or whatever disease you're testing for. And now what you're going to do is you're going to get your actual patient. So this is the patient from 1.4, the one that we want to test for. And what we're going to do is we're going to pour this patient sample over here. Next door says patient, 3 or 4 drops. And now all we really have to do is just pour that same chemical indicator into the patient and compare. Does our patient compare favorably to the salmonella? Or does our patient compare favorably to someone who does not have salmonella? So is our patient positive for the disease, or is our patient negative for the disease? So we pour that in there. And you can see that it in fact turned blue. So this is a simple case of our patient testing positive for salmonella, because we can compare. You can use your toothpick. You can mix it up a little bit. Compare them out. You can see that the patient here compares strongly to the one with salmonella. Now, what would it look like if we were wrong? If we were wrong and it wasn't salmonella that we were testing for, this is an example of a patient that does not have salmonella, and this is what that would look like. So let's say we're testing a patient, and say we think this patient has salmonella. Put the indicator in there. And you can see this patient here, patient number 2, compares for the negative. So this patient has salmonella. This patient does not. And we can just literally just compare it. And what they'll do is they'll take a photograph of this, take a scan of this, send it back to the doctor, and the doctor will know, all right, our patient has compared to positive salmonella, or our patient compares to negative salmonella. And that's one of the ways that chemical testing is done to see if patients have a disease or not.